Thank you, Dr. Mridul Sahani. Thank you all. And now it's a time to start the international session. Today is the 1088th day of the uninterrupted daily webinar of Ifph. Before beginning the session, let's have a silent prayer. Hello, loving homeopathic doctors, people working in various fields of homeopathy, students, relatives, well-wishers, and masters of homeopathy. Today is the 1088th day of the uninterrupted daily webinar of International Forum for Promoting Homeopathy. And today with us is Dr. Javedh Akther, our guest. He is a legend from Pakistan, member National Council for Homeopathy, chairman of Professional Development Program of Homeopathy, Government of Pakistan, many years of teaching experience. He is a mentor of homeopathy, a person exploring the works in homeopathy, and the topic is a case of chronic kidney disease treated by single homeopathic remedy, pulsatilla. Let's welcome Dr. Javedh Akther, and I welcome you all for the session.
Thank you. Thank you. Good evening. I'm Dr. Javedh Akther from Pakistan. I'm very thankful to you. I'm very thankful to you to the IFPH forum. I'm really grateful, sir. I'm really grateful to all of you, and you have given the opportunity for the presenting my case. And today is the 10 session of IFPH. Really, it's a great contribution in the world. The IFPH forum is contributing, and who give me opportunity to present my case. Today, my case is the chronic renal failure, basically CKD. This is a very, you can say, a very fatal disease. It is very difficult to treat, and it's to take the result of this such a fatal disease. So today I am going to decide about how homeopathy can treat it, how we can manage it, and how we can deal such type of issues. Patient visit to me 2019, and today the 4 years I am treating. Patient was feeling well, but not totally cured, but the patient was responding excellent. It was improving day by day. As you know, when the patient is suffered from such disorder, CKD is a grade second or third stage, and this patient on the dialysis, and as you know, there is no response. Well, however, in homeopathy, if we treat it properly, we can take such a beautiful response of this. And now I'm going to present the properly presentation of this case. This is my qualification. I got the M.Phil and BHMS, and I'm doing a lot of work in this field. I got the bachelor degree in the homeopathic medical science, and also I did the clinical pathology, and doing the work as a mentor. And also I know about the mental symptom. I used to take the second protocol, and this was a patient who visited me. You can see this the CT the report of the ultrasound findings. The patient's CMD, cortical medullary disorders over there. There is a cyst is also present in the right side of the kidney, 3.12 and into 2.77. It was second grade. This is a second grade, you can say. And the creatinine level of the patient was at onset 11.4, and it was urea was 144. 11.4, it is a milligram per deciliter, and it was a right renal cyst over there, bilateral renal cortical cyst. These are the complaint. Patient age 34-year. Patient name is Sajad, and he visited to me 13 June 2019, and GFR rate at daytime it was the 6. And as you know, there is a more than 50 or 60 is the sometimes some says that the 90, more than 90 is a normal, but it is a 6 is the more fatal conditions of this. This is the values of this CKD GFR, and you know about this. And the patient's diagnosis CKD, chronic kidney disease. Patient's version, what was the patient version, and what patient said to me? I'm going to say here what the patient says. My creatinine level is high, feeling not well, suffering from 6 months blood in urine was there. I didn't bother. My mother said to visit doctor little better month ago. Little better a month ago, consulted another doctor who advised ultrasound and renal function tests. Then it was diagnosed CKD. I come to know about you. You are a competent doctor, thus I am visiting you. My father was in a hospital suffering from chronic liver disease. I am continuously nursing day and night from 1 year. After that, I am suffering. My mother is also patient of HTN, hypertension. I used to give a lot of time my family. I have consulted many doctors. They advise dialysis. Doctor, I asked the question, any tension about this disease patient? No, 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 nothing, any tension. I know you are competent doctor and Masi and Masia. Doing special favor for the patient was asking me, doing special favor for deserving patient. I am expecting the same. This was the case. Basically, it was a lot of conversation, but the crux of the conversation was there. So I interpreted such a case. I'm going to say here the one thing, what can take in chronic cases and in acute cases, it is a little bit, history is different. Because in this case is taken on the, one is a triple P, present persistent predominant, and second one is a CARS, concern, adaptation, reaction. And we have to take what's the patient concern and what is the adaptation, why it was happening, and what is the reaction of the patient during the suffering. And in chronic cases, we used to take such a disorder which are constitutional type. But in this case especially, it was nothing to so much special. So whatever over there I took over there, that is that on the basis of triple P. So, and after this, this is the analysis chart of the patients. I took the first rubric. I'm going to explain it with the version of the patient. Patient said to my kidney level is high, feeling not well, suffering from 6 months. Bloody urine was there. I took the rubric mind delusion sick being. This basically indicates a delusional belief or perception related to being sick or unwell. The individual might have false or exaggerated belief about their own health condition. This was the condition of the patients at that time. Told me. I took the exact version of the patient and then interpreted in the homeopathic language. And second was the second version of the patient. I didn't bother. He was suffering. I did not bother it. So this is a frivolous attitude. So I took the rubric here: lack of seriousness, depth, of importance. Okay. And then another version of the patient. Then I come to know about you. You are a competent doctor. Thus I am visiting you. So this is the what is the basically patient was impressed. So rubric is taken as impressionable, easily influenced, or susceptible to being shaped by external factors, idea, or experience. And another version of the patient, my father was in hospital. Uh, uh, my father suffering from chronic liver disease. I am continuously nursing day and night. From 1 year after that, I am suffering. This was the basically adaptation of the patient. It's the adaptation. So I took the rubric nursing of others ailments from. Nursing of others ailments from. So the what is the interpretation of this rubric? Tendency to care for the nurture others. In other words, when they engage in caregiving behaviors, they might be prone to developing certain ailment or symptoms. And then another version of the patients, I'm consciously nursing day and night from 1 year. Patient says, I am consciously nursing day and night for 1 year. I took the rubric nursing of others sits up with sick person. Okay. So what is the interpretation of this rubric? This indicates a caring and nurturing behavior toward others, particularly those who are in need of care or supports. Sits up with sick person. this describes the behavior of sitting up with the sick individual. This might mean that the person feels that the need to be physically present and provide comfort and care to the sick person, often by sitting beside them. Then another version of the patient, my mother is also patient of HT and hypertension, and I used to give a lot of time my family. So I took the rubric here, love family part. My mother is also patient of hypertension, and I used to give a lot of time my family. This is basically love family. This indicates love is present in the mind of for the purpose of nurturing and maintaining strong family bonds. Caring and nurturing behavior toward others, particularly those who are in need of care or support. Another version of the patient, any tension about this disease patient? No, nothing, any tension. I have no tension about this. I took the rubric is affectation. What is affectation? Basically, the interpretation of this rubric behavior that is artificial, exaggerated, or insincere. It implies to deliberate attempts to appear or behave in a way that is not genuine, often with the intention of impressing others or gaining attention. Basically, when the patient is suffering from such a fatal disease, and if you ask that patient, have you any kind of tension and have you kind of problem? So patient said, no, nothing, no worry. But as you know, this is the artificial attitude. There is a lot of tension, there's a lot of depth of this, and patient is saying, I have no tension. So I took the rubric, and in this such a case, if the patient says such a fatal disorder, and you can take the such a rubric over this affectation. And then I asked the patient, any tension about this disease? Patient is nothing, sorry. Patient there is nothing, any tension. So no, sorry. Patient version is the I write the version is. I know you are a competent doctor and Masi are doing special favor for deserving patient. I'm expecting the same. This is a version of doing special favor for deserving patient. I'm expecting the same. So I took the rubric here. Bargaining. I know you are a competent doctor and Masi are doing special favor for deserving patient. I'm expecting basically bargaining. What is the bargaining? Bargaining basically patient takes a favor. Patient take the, if you are go to the bazaar and if you can give the take the can do have to do some favor and some type of this, and that is the bargaining, and it's a pastoral attitude bargaining. Okay, so this was the case, and now you can see the chart of this. This is the chart of this nursing of the ailment, nursing of the sits up with sick person, love family, anxiety, family bodies, delusion sick being affectation, frivolous bargaining. You can see the pastilla comes here. The medicine is a remedy of this patient is pastilla. Now I'm going to go to the follow-up. What is the follow-up of this patient? In early days, I took I used to take the in 2-3 days, 4 days, even after a week, and gradually 15 days. Till now, 4 years which was passed, but I'm taking the after 15 days. And the routine, I'm taking the routine tests, urea and creatinine, and all other relevant tests I've used to take over there. Okay, what is the changes over there? And this was the reports of the patients. You can see here report of the patient. In routinely, I took the test hepatitis B/C because these are the very necessary when you take deal with such a fatal disorder. Hepatitis B/C was negative, and you can see here H. pylori antigen. It was HCG. It was H. pylori test. It was positive. H. pylori antigen was positive. And what is the? It was this test was taken at the what is the date of this patient's urea? 67, 1 creatinine. Yeah, this is a follow-up basically patient of this. You can see the report of this 2023 at January of 2020. Creatinine level 1.8 and uric acid 7.8. Urea is 57 and GFR 14, 48, 49. These are your GFR is a 49. And you can see this is here is a this is the report of the patient of the endoscopy, soft intuition Hill's grade 2 hiatal hernia, and it was another is the fuse erosion seen in the pyloric. This was the erosion in the pyloric sphincter abdomen. Basically, I will explain it later on. What was the happening over there? These are the findings of the 23. Okay, now I'm going to tell you okay, what is the difference between when the patient was being treated. This is the last 20 after the 4G report. At the first report, it was that you can see right size cyst was 3.12 and 2.77, and it was the poor CMD grade 2. And after the 4 year, you can see here the size of the cyst right side. It was reduced by 3.2 to 1.8. Size of the cyst was reduced 1.8 into 1.8. One is the achievement. Second is the achievement. What kind of grade 1? Okay. Now it was the patient is grade 1 and 2. Before that it was the 2 and 3. Now it is the grade 1. And another is the success stories. At that time it was a poor CMD. Poor CMD. And now it is a preserved CMD. Preserved CMD. You can say this is you can see here, this is the preserved. Left kidney preserved CMD. In preserved CMD, you can see here the preserved. What is the difference between poor CMD, cortical medullary, and this is the preserved CMD? What is the difference between both of them? Now I'm going to explain it, but after the reporting, it was a first time report. You can see the reports. It was the date is the 2019. It was urea 144, creatinine 1.5 with the other sodium potassium and GFR 5 and 6. And now, what is the difference between the poor CMD and preserved CMD? Poor CMD could potentially refer to various things, such as a cortical medullary differentiation in the context of the kidney. Cortical medullary differentiation is the distinction between the outer cortex and inner medulla of the kidney. Poor CMD could imply that this distinction or differentiation between these two regions is not as well defined as it should be. Preserved CMD. What is the meaning of preserved? In this context, preserved means that the particular features or characteristic is maintained or intact. It suggests that whatever is being referred to has not experienced significant changes or abnormalities. Cortical medullary differentiation. This is the referred to distinction between the cortical medulla and organ. Particularly in this case, the kidney healthy condition shows the clear differentiation appearance on the function between the two regions. So preserve cortical medullary differentiation indicates that the medical imaging study, the distinct appearance of functional separation between the cortex and medulla of the kidney are still clearly visible and have been significantly altered or disrupted. This is generally considered as a positive finding. This is basically preserved CMD. It is a positive finding. It suggests that the structural integrity and functioning of the kidney are relatively healthy. So you can see the findings before and after. It was a poor and now it is a preserved CMD. It means now it is a positive findings are coming over there. And another is this is basically achievement of the kidney and gradually with the 4 year of treatment. and what kind of complications during such critical fatal disorders I faced over there, and I used to face that everyone is facing such type of the problems. Common complication of the CKD, common complication, it maybe can be any kind of common complication. One is the major is the anemia too. And what is the anemia? Why anemia is occurring? Decreased erythropoietin. Basically, erythropoietin is the hormone produced by the kidney, is response to low oxygen in the kidney. Kidney function decline. There is a reduced production of erythropoietin that leads to decreased stimulation of the bone marrow to produce a red blood cell. Basically, adrenal glands over there in the kidney. If the CKD patients, when the basically kidney is not functioning and the adrenal gland definitely not functioning, it produces erythropoietin. This is the role of erythropoietin. So erythropoietin, when decreased, it means your hemoglobin become gradually decrease. Okay, and another is the inflammation of hepcidin regulation. Basically, inflammation of common is CKD due to various factors, including immune dysregulation of uremic toxin. Basically, when urea is increased, or that become toxic for liver, and this is also hepcidin in the liver. The inflammation of hepcidin and stimulate the liver production hepcidin, which inhibit iron release. This basically is inhibit the iron from storage site and reduce iron absorption from the intestine. This further contribute the iron restricted erythropoiesis. And basically, now what kind of things we have to judge over there? Here, very important factor which I'm going to tell you. We have to note it when we are dealing with such fatal disorders. If the complications are related to the relevant disorder means that if in the CKD patient there is a commonly anemia over there, it means it's a part of your disease. It is a part of your complication of this chronic disorder. So as my experience, I have treated number of patients. Here I do change the potency, not change the remedy. I used to take the potency. I increase or decrease. Okay. Most of the cases, but a few cases may be different, but most of the cases I used to change the potency in 630, 201 M, 10 M, 50 M, LM, whatever the in LM scale or decimal scale and whatever. At that time I do the practice. Second one is if the disease is not the relevant part of the disorder, then I used to take a new case at that time. At that time, I take the new case. Here, I'm going to example here. Treating acute illness in chronic diseases. Take a new case here. Treatment acute illness in chronic disease. Take a new case. Focus on predominant acuteness. Stop chronic phase medicine. Stop aware about acute phase related to chronic disease. If yes, then need to change of medicine. If right simulum selected, if the acute phase is not related to chronic disease, then take acute case, a new one. And during, okay, now I'm coming to this patient. This patient was suffering from another anemia. Patient was suffering in 4 years. He visited to me with anemia, with 4 and 5 hemoglobin, and severe abdominal pain and melena, black stool. This patient was suffering, and H. pylori was positive. And what I did over there, before this, I'm going to tell you about this. And if the anemia is there, what we take the measures in being homeopath, what kind of treatment we can deal over there. These are the factors. These are the common factors. Treatment of erythropoiesis stimulating agents. Normally in allopathic, they are used erythropoiesis stimulating agents. They are used over there. And another is a iron supplement. Iron supplementations we can use being homeopath. We can use during the such cases if the patient is anemic due to the adrenal glands insufficiency, erythropoiesis are not over there, and at that time supplements you can use a different diet factors with which have enriched in iron. In allopathic point of view, this is a hepcidin modulator. They are using because they are reduce the toxins. And underlying kidney, the treatment of underlying kidney disease, this is the basically in allopathic style they're using over there. Nutritional support, and you can use the such nutrition, such type of the diet, which are the anti-inflammatory therapy. Anti-inflammatory therapy, it was used in the allopathic science. And the homeopathic doctor can also use the blood transfusion if the patient is not responding with the such type of, they have no restriction. They can advise the patient that they use to blood transfusion in severe cases. And careful hemoglobin monitoring, collaborative care. This is basically all of the either patient is in homeopathic field, homeopathic side and allopathic side. You have to bother it clearly. You can see what it. This was the basically protocol you have to give during the such type of the disorder during the suffering. And this patient was patient was in anemia. The patient visited me with abdominal pain, and it was severe anemia. It was 4 and 5 hemoglobin, and melena, black stool, and severe abdominal pain. I treated 1 or 2 months, but it was not responding. I referred to the allopathic side and also homeopathic side. May someone else can treat such type of disorder, but they visited many doctors, but in vain. No response over there. Again, the patient visited to me. I was treating the kidney disease, but CKD, but this was not by handling me. I was not managed to this disorder. Is protocol was not clear. What was that? This was the anemia, erosion in the bowels. Then I decided to take the whatever I did it. But at that time, the patient said to me, "Doctor, give me the proper time, and you are a competent doctor, and I have to treat yourself, and you have to focus over there." So the patient visited to me for 1 or 2 hours. Then then I said over there, and what kind of things I have. This anemia chronic disorder. In this case, there. Then the blood was lost in the to the patients.
Let's wait for a while. I think some technical issues there. Let's wait for some more time. And before Dr. Akther is here to rejoin here, let's have a quick look at pulsatilla itself, because a lot of persons will be easily able to say a lot of things about pulsatilla because it's a very common medicine. And let's have a small discussion on that. You can hand raise yourself, that I can unmute you. So what pulsatilla is? Pulsatilla is a timid, thirstless, aggravated from fatty food, changeableness, warm, consolation, ameliorates, this type of thing. We can we can perceive from pulsatilla, and it's a plant medicine. So the treatment of CKD with pulsatilla, this is what Dr. Akther was saying. And I know a lot of persons will be here to explain or relate it with your experiences. Yes, Dr. Javedh Akther is here. Let us check.
Sorry, sir. I'm sorry, it was, I don't know what happened. It was never before this. It was some troubleshooting over there. I'm extremely sorry for this. Okay, sorry for that. And okay.
Yeah.
So here,
Still the voice is breaking.
okay, sir. Still voice is breaking, I think.
Now it's okay. You please speak again.
Okay, sir. You can listen, sir. Okay.
Yeah.
Now
Yeah.
voice is clear, sir,
Please
please.
continue. Yeah, it's clear.
Voice is clear, sir, please.
Yes, yes, it's clear.
Hello. Okay, okay. Thank you. Thank you. Oh, thank you, sir. Thank you. Here, okay. Here, the one thing is very important. The patient was coming to me with pyloric erosion at the hiatal hernia and H. pylori pus. Actually,
Yes.
suddenly I'm handling, but it's difficult managing over there. I think this is some kind of problem over there. However, sir, I don't definitely it is a part of our life. It's happening. And sir, here is the anemia of chronic disorder. Basically, one thing very important here, you have to correlate: is the disorder is related to this or not? If it means that you must be aware of the depth of the disorder. If it is not related, then you have to take the new one case. So I took the here is the new one case. What the patient said to me, I have treated my phase, but no response to the allopathy and homeopathy, but no recovery for 4 months. I have treated, but after it, patient again visited me for this purpose. I have severe pain in abdomen. I used to hold or press abdomen, feel better, and when pressed, due pain I used to take rest. I am very hopeful you can treat this one. Doctors, that's how I don't go here and there. I will stay with you. Only you treat me. This was the version of the patient, and but I analyzed this version. You can see it. One is the patient. Um, Hold the patient and press the patient. Hello?
Yeah, audible.
Hello?
Yes, yes, we can hear you.
Hello? Okay, sir. Okay. So when a patient said to me that my abdomen, I feel a little bit bad. Okay, sir. Okay, sir. So I took here the rubric health emulation and patient and dead time rest. And said to me that you are the competent, I have to go to you, you have to treat me, and I will listen with you. This is the rubric is to be. And patient was, I okay with you, I will be okay. So the rubric is awful. And another, there's a physical, generally hemorrhage, a very specific rubric is a stool black straw like burnt. This is the only Lexis. You can have after the patient. Hello? Yes, please. Hello. Sir, can you hear me, please?
Yes, yes. Please. Please
This
continue.
troubleshooting is like this troubleshooting is this troubleshooting look like a chronic renal patients. Okay, today because topic is so fatal and the troubleshooting is over there. I'm sorry, it's not part of me, it's a part of disorder. Okay, so what happened? You can't imagine the doctors, and he was inoculating the different blood transfusion and number of therapies he did it, but still it was no response. Patient again anemia, stool was there, and patient severe abdominal pain, but no response. Then I have selected the right simulum. You can't imagine it. After 1 week, the patient visited to me, there is no pain, there's no black stool. And after 2 weeks, at that time, it was hemoglobin was 5. After the 2 week, patient come visited to me at the hemoglobin was at 10. 5 grams are, you can say, was without any transfusion, only single remedy of the Lexus 200. This is the basically the right similum after this. And hernia gradually it was disappear. And another thing is the meanwhile, I'm going to tell you here, and sorry, basically here I told you, and you can treat the such type of the patients if the suffering and these different type of disorders, and you have to take accordingly. And if not related, then mute case. If related, then you have to increase or decrease the potency. This was my opinion and about this CKD disease. This is basically most of the people are claiming that we are treating the such type of disease. Here I'm going to tell you what kind of pulse stela 6 centimal scale. It was not responded by LM, not responded by 30 and 200. It was responded by 6. However, meanwhile, the patients gradually creatinine was reducing. At the onset it was 11.4, and gradually it was 7, 8, and then it comes down at 1.8. It suddenly increased to 8, and at that time I've given the 1M potency, but still a 1M, and again the creatinine level become 3.4, 2.8, and after that the patients according to the severity and if the creatinine is little bit high, I'm going to increase the potency, and only single or 2 doses. And then comes the Pastella 6. It was the management of the patients, and Pastella 6 was there. It was continuously given the patient to stop the medicine. I am given the not regular alternate day, 3rd day, 4th day, but not daily. And if potency going to be increased, if the creatinine is high, only single, then again come to low potency. And now 4 years passed, the pathology of the depth of the disorder is going to be used. Patient is after the he was at the bed at the home. And after 1 month, patient was working. He is working is normal. Everything is normal. Nothing to worry. Our treatment is on. Basically, only some disorders. Once a time he was getting a headache over there. And once a time is I've given those medicine and patient was cured. And again I come to the Pastella. Basically, here is what is the important of this. Basically, the more difficult process management of the follow of the patient. Most of the doctors can select the right similum, but what the difficulty is you are facing with such type of defects, that is the follow up. And now you can see over here, for 4 years, the patient creatinine was going to stable. Number 1, cyst was down, size was decreased, grade 2 to 1, poor CMD to present CMD. This is the very progress. You can't achieve it within days, you can say, if you because one thing is basically allopathic science claims that if your kidney tissues are damaged, it cannot be repaired. Homeopathy says it can be repaired. Hello, please. Can you hear, sir, please?
Yes.
Hello?
We can hear you.
Hello? Okay.
Yes.
You can hear, sir?
Yeah, sure.
I can say, being homeopathy can work, and pathology can improve. This is a you can evidence-based case. evidence-based case. Now you can see it. It was it takes 3-4 years more. I hope patient will be cured. Absolutely, you can say here at this time patient is on the treatment. This was my case. Thank you to all of you, and can ask me any question, please. I am here, please.
Thank you, Doctor. Thank you
I'm
for the session.
sorry, but troubleshooting today is
No, it's not our problem because it's technical glitches. It can happen. Okay, so it's the time to interact with the speaker. Participants can hand raise. I can unmute you. Dr. Ali, Dr. Javedh Awan.
Welcome, Dr. Naveed, please.
Hello, sir. Good evening. All the honorable members of IFPH and today's special guest, Dr. Javedh Akther, who presented an eye-opening case of CKD, having cyst which is considerable as incurable. But here, not only the cyst size reduced, but also the kidney function got normal level to the creatinine. So congratulations to you, sir, very much for excellent approach and managing such incurable case, and you made it cured. Very excellent, sir. So
Thank you.
All time we learn and hear something new from you. Today, the new shade of re-case taking of patients having such other problems, like today patients, this patient of CKD suffering from anemia. So I want to share that many times when we deal such cases, we also face such other problems, like some patient are passing through the body pain or some backache pain or joints pain. But we are just stick to our remedy. We not change here, because we also have the apprehension that patient will out of the order. So today, sir, thank you very much. You gave a new shade that such cases should be treated, and such patients should be re-case taking. Another one thing more important, which I have learned today, your fruitful lecture. Only right medicine, right simulum is not necessary. Right potency is also necessary. You share your experiences that when you go up the potency, then the creatinine get higher. And today's at this honorable forum, I want to share here that one of my case was CKD, and I also got the opinion, precious opinion from Sir Javedh. That case was cured by belladonna. Same here with that patient. I have started using the patient belladonna 6. Patient was going very smoothly. So after that, after some time, I used belladonna 200. Then 1M. What happened? Patient creatinine raised. I was very worried. Why patient's creatinine level is going higher? Although that was the right simulum of the patient. Then I got the precious opinion from Sir Javedh. He advised me to stick to belladonna 6 only. So what was the positive point of belladonna 6? That not only cured the cyst of the patient, but also got the creatinine to normal level. So thanks a lot, sir, and very, very congratulations to you. And I also congratulate to IFPH, who are playing a very vital role in promoting the homeopathy. Thanks a lot, sir.
Thank you. Dr. Naveed, thank you, please.
You're welcome, sir.
Next
is here is a one thing I'm going to mention here. This is the evidence-based. Please, evidence-based. single remedy evidence-based case. Most of the homeopaths are telling me, I listen over there, in the chronic or fatal cases, you can't prescribe, you cannot single remedy work over there. You can use multi-dimensional. But most of the cases, I used single remedy. Yes, sir, please.
Dr. Tansila Khalik.
Yes, sir. Thank you so much, sir, and IFPH channel. It's very nice case and wonderful to see that changes in the lab test also. It's not, no doubt, it was very difficult to observation and understanding about the case. But sir solved easily because he always using the law of case taking especially, and mostly Sir Javedh Akther basically working by medical power basically, and especially I appreciate to this forum because, and sir also Sir Javed is a very blessing from God for all of us. And so I also proud that I'm student of Sir Javed. I'm first student of Sir Javed. So really, a lot of cases same like this solved by Sir Javed. And now we are also able to see and observe same cases, and we are also solved mostly difficult cases because under the supervision of Sir Javed. And especially thank you so much, sir, and this IFPH also. Thanks to all.
Thank you, Dr. Tansila. I'm really proud to be being such a wonderful student, Dr. Tansila. I'm proud to be. You are really doing a lot of work, and thank you for homeopathy and as well as for the community. Thank you, sir. Please.
Next is Dr. Ali. Doctor, we are having only 1 or 2 minutes, please.
Honorable Sir Dr. Javedh Sahab and Honorable host and Honorable member of IFPH, Assalamu alaikum and good evening. I am feel proud that I am member of IFPH and the great platform worldwide for promotion of homeopathy. I almost attend daily basis webinar, but I see the approach of Dr. Javedh Akther is a good sniper by homeopathy and Segal method, especially. I appreciate Dr. Javedh Akther, which cure incurable cases by Segal method. And this cases I see not a single CKD, but syndrome of disease, pathological changes, which is very difficult to cure. But by the approach of Dr. Javedh Akther by Segal method is really cured by homeopathy by accurate remedies. And at last, I appreciate Dr. Javedh Akther and congratulations, and appreciate also form of IFPH which promote homeopathy worldwide. Thank you, sir.
Thank you, Dr. Ali. I'm really grateful to you. Being a part of homeopathy and my student, I'm really grateful. Thank you.
Thank you, and let me welcome Dr.
Sir,
Dhanish
please.
for the concluding remarks and for the vote of thanks.
Thank you, Javedh Akther, sir. It's really a very wonderful presentation, sir. Nobody can believe that homeopathy single remedy can do such wonders in chronic kidney diseases. Usually, everyone goes to the other side for such cases. But what they can do is just manage. They can manage, but never cure. But as you rightly point out, that homeopathy can do total cure to the patient. So exactly, you have chosen the right remedy, and you know whenever at what time you need to change the gear, just like in potency, and you have done it in style also, and that yielded the correct result. Of course, with this kind of a single remedy presentation is really wonderful, and we hope we can produce a lot of such cases in the future also. Most of your followers, particularly Dr. Tansila and all team, are doing wonderful job, and they are also presenting some of the best cases from their kitty. And we are thankful to Dr. Javedh Akther and his team for such making this platform a brilliant one. And as everybody is watching from different part of the world, to see how homeopathy works with all over the world. I am proud to be thank to you as well as your team for this success of this kind of cases in Pakistan. And you are doing a lot of work for promoting homeopathy in there also. Thank you on behalf of International Forum for Promoting Homeopathy, as well as on my personal behalf. And thanking you once again for this wonderful session, sir. Thank you very much, sir.
Thank you, sir.
Thank you.
Sir. Thank you.
And over to Malayalam, the regional language.
Thank you, sir.
Yes, Dr. Hubert, begin, sir.
Yeah, okay. Thank you, Dr. Binduraj and Dr. Namaskaram. In